Canada is a recognized leader in global health here at home and in some of the poorest and most remote regions of the world. Building on our efforts and our successes, there is an opportunity to have an even greater impact on the complex issue of global health by engaging all sectors and ultimately enhancing Canada's leadership role. In September 2010, the Canadian Academy of Health Sciences convened the expert panel on Canada's strategic role in global health to assess whether Canada should play a more impactful role. The aim of this report was to catalyze a national discussion about Canada's role in global health, not make specific recommendations. The report is an evidence-based assessment of Canada's current role, highlighting Canada's strengths and opportunities, possible roles for Canada, and a potential path forward. The process of developing this report was rigorous. The Council of Canadian Academies managed the process for the Canadian Academy of Health Sciences and a broad range of diverse and distinguished panelists who were selected from across the country and around the world. The panel articulated 5 roles that Canada could play: Indigenous and circumpolar health research.
It's important that people first recognize that Canada has a rich Indigenous culture, but that there is about 500 million people worldwide who are also meet the United Nations criteria as Indigenous peoples. With our relatively small numbers of resources, what are we kind of good at? Well, the circumpolar northern, the Indigenous communities, I think that's a good start.
Population and public health.
We know that social conditions are one of the biggest determinants of health. So whether you're poor, whether you live in a safe environment, what your housing is like, all of those determine about half of your health. And yet very small parts of global health are dedicated to addressing these major determinants of health. That's something that Canada could make an enormous impact together in effective partnerships with colleagues from around the world.
Community-oriented primary health care.
Community-oriented primary health care is really about a way of approaching primary health care that's both service-oriented and also participatory-oriented, so that people receive care but also participate in the determination of what is appropriate care and are also part of the governance process.
Smart partnerships in education and research.
If the implementation takes place in such a manner that the low and middle income countries are encouraged to have a greater sense of ownership on the activities that are undertaken, and also if the low and income countries do identify their priority areas that Canada can respond to, then the impact will be extremely great.
Global health innovation.
The report really stresses the important role of innovation in addressing global health challenges. Science and technology innovation, social innovation, business innovation. What does innovation mean? What it really means is that tomorrow will be a brighter day than today.
This assessment is not the end of the conversation on Canada's strategic role in global health. It is just the beginning. Connect with us on our Facebook page, Canadians Making a Difference, and be part of the broader conversation to engage all sectors, focus on results and accountability, and enhance Canada's role in global health moving forward.
Responding to this assessment, that we'll see a more effective and profound contribution from Canada in this important issue of global health.
Global health isn't about one sector doing things independently, but by working together in a concerted effort, we can have a greater impact.
Our report is called Canadians Making a Difference. And that's because Canadians have made a big difference in global health. What our report envisions is that we move from Canadians making a difference to Canada making a difference.